اسمي نور، عمري 31 سنة. كانت عندي مشكلة من 10 سنوات، بس ما كانت عندي أي أعراض إلها. بس قبل سنتين بدأت تتزايد الأعراض عندي. قمت ما أقدر أمشي مسافات طويلة، ما أقدر أصعد درج، ما أقدر أتنفس بشكل طبيعي، دقات قلبي تتزايد، يصير عندي ضيق بالنفس، ما أقدر أنام بشكل طبيعي.
Her name is Noor. She had a problem with the heart since 10 years ago. It was asymptomatic, no symptoms at all. 2 years ago, she started getting the symptoms. She was feeling tired. She was not able to walk for a long distance. Not able to climb stairs. Dizzy. She went to many doctors, and they weren't able to treat her even through surgery. And they advised her with the heart transplant. When she contacted me, I have a friend. He told me you should take her to Sagar Hospital. We came from Iraq. Actually. Everything goes well, and right now she's happy with the result of the surgery.
Here, had this patient. She is a 30-year-old girl. She's from Iraq, and she's a microbiologist. All of a sudden, she developed some breathing problem and the symptoms of respiratory infection 3 years back, and she was evaluated in Iraq. And on further evaluation, the ECG was showing some abnormalities, and the echocardiogram was also showing some kind of a tumor arising from the heart. And they told her that she is suffering from a rare cardiac tumor, which is very large, and there is no treatment. And all of a sudden, she was shocked that she was able to start her career as a microbiologist there. And out of despair, she started going to other cardiac centers for further evaluation and in search of a treatment. And she landed up here around 15 days back with me. And when we evaluated what kind of a tumor she has with further tests like CT scan and MRI, we found that this tumor is quite large, very huge, giant tumor arising from very important and critical structures from the left side of the heart. And we found that this kind of tumors has to be resected and has to be treated with only surgical option, because she was having all the symptoms of congestive cardiac failure. She had worsening symptoms of breathlessness, that is breathing problem. She had palpitation. She had syncopal attacks. She could feel arrhythmias or missed beats hearts, and also she was having chest pain. So if you leave it like that, she would have either died with cardiac arrhythmias or congestive cardiac failure. The only option was surgical resection, and we successfully resected this tumor, which was almost 80% of the size of the normal heart, around 7 to 6 centimeters. We had to remove a part of a normal heart as well, because this kind of tumors, they invade into the normal heart muscles, and there is no clear-cut demarcation between the tumor and the normal heart muscle tissue, and there is no capsule around the tumor.